Hello, my name is Dr. Michael Spira. I'd like to talk to you today about arthritis. Arthritis is one of those painful conditions that affects 1 in 7 of us in the United Kingdom. It is the cause of chronic pain. Now, the definition of chronic pain is pain that's been with us for longer than 6 months duration. One of the major causes of that is what's known as osteoarthritis. That means wear and tear or degenerative arthritis, where basically the joints just simply wear out. And it affects all the major joints: hips, knees, hands, shoulders. And because it's simply a wear and tear, there is no real cure. The only cure eventually, of course, is to replace the joint if it gets really bad. So sufferers have to resort to taking painkilling drugs on a regular basis. Now, in osteoarthritis, joints become swollen, they become painful, and they're stiff. And as a result, people with osteoarthritis, their mobility becomes affected, and that makes the problem even worse. So I've been very interested in looking at different ways of that might be helpful for us, for those of us who do have painful joints, other than just simply taking tablets. Now, I must stress at this point, if you are on prescribed medication, please do not stop taking that prescribed medication without your doctor's explicit approval. So these are just additional ways that might be very helpful. Now, one of the ways I've been particularly interested in is microcurrent therapy. Now, microcurrent therapy is not a new therapy. It's been around for, since the 1970s. And there's been quite a lot of research done into it. It's a healing method which is used by a lot of professional sports people. Aston Villa and Tottenham, they use it for their footballers to get them back playing on the pitch as soon as possible. International rugby teams, England, Scotland, Wales, the microcurrent therapy is used for those people. Olympic athletes, ballet dancers, and the aim of microcurrent therapy is to provide rapid and effective pain relief. And all it involves is really just passing a very tiny current to the affected parts. Here's an example. This one, MicroDoctor, is a microcurrent therapy product. And you have pads like this, and you have control here. And simply by using this control, you then pass a tiny current through the pad into the affected joint that you've applied the pad to. So what is the research, what's the evidence that microcurrent therapy using devices like that may be a benefit? There is quite a lot, and I've got the research here, and I'd like to share some of that with you. In 2001, the American Journal of Pain Management published an analysis of 2,500 patients who had completed survey forms, and they found that 93% of those who used the device claim significant pain reduction. That means more than 25% improvement. That was pain which might have been not just arthritis, but it might have been pain from migraine headaches, it might have been pain from carpal tunnel syndrome, rotator cuff lesion, all sorts of things like that. Another study also showed a significant improvement, 93% improvement in pain. Interestingly also, because pain of course is often associated with anxiety and depression, they found that using microcurrent therapy also produced a significant improvement in anxiety, 93% were the figures they found, 89% in depression, 93% improvement in stress, 79% improvement in insomnia, 90% reduction in headaches, and 95% relief of muscle tension. Now, the question also arises, and I'm particularly interested in, is can microcurrent therapy help to reduce joint pain and swelling? Now, I found a very interesting double-blind clinical study. This was a study done by Dr. Chapman Jones, a specialist in musculoskeletal medicine and a medical researcher, and he organized this study based on microcurrent therapy, using in fact this particular device for sufferers of osteoarthritis. The study was undertaken at the Department of Orthopaedics in Kent and Canterbury Hospital, and the study got approval from the local research ethics committee of that hospital, which is very important to know that the research is being done in a proper and professional way. All the patients recruited had a diagnosis of osteoarthritis of the knee and had been suffering for a period of longer than a year. The patients were all in a similar age range, between 55 and 70. And a double-blind method was used. In other words, half the patients had the pad and had a device that looked like that, but there was no actual electric current going through. That was the placebo group. And the active group examined exactly the same pad and control, etc., but they did have the microcurrent going through. And what they found was this. They had 30 patients, 15 were active treatment, 15 were the placebo. In the placebo group, 80%, that's 12 of those 15, reported no significant changes in their symptoms in terms of pain, swelling or mobility. Whereas in the actively treated group, 73%, that's 11, reported a significant improvement in their symptoms and found that they were in less discomfort and were, as a result, more mobile. Now, another interesting perspective on the efficacy of microcurrent therapy is in the control of post-operative pain when you're having something major done like total knee arthroplasty. And the International Orthopedics Journal published such a paper in 2007. And what they found was that the use of microcurrent therapy significantly reduced the need for post-operative patients to take very potent painkiller, tramadol. And this, they therefore concluded, that microcurrent therapy led to better pain control with a markedly reduced need for strong analgesics. And interestingly also, not only was the pain control much better, but also there was better healing of the wound. Another research paper was published in the Journal of Athletic Training. In fact, I've got a whole bunch of research papers here. There are about 60 or 70. I'm not going to go through them all, but they're all either in physiotherapy journals, athletic journals, chiropractic journals, and they're all very good quality research that shows that microcurrent therapy can be extremely helpful in helping to reduce the swelling of joints, pain, stiffness, and increase mobility. If you want more information, please do click on the website, but I will thank you very much for watching.